epidemiologist. How many of you woke up in the morning and said, okay, that's my goal. That's what I'm going to be. Let's just talk about science. Let's talk about the thought process that goes into vaccines. Dr. Murray Cohen is a retired member of the CDC. This man knows what it's like to work in the area of science. And I want to get on with him here. Dr. Cohen, good to have you coming down the road with us.
Joel, thanks for the opportunity to speak with you and your audience.
20 years with the CDC, crafting policy and bringing science to light. I mean, how frustrating is it to know there's a vaccine out there and not see it being used by many people?
It's beyond frustrating. To some extent, it's terrifying. To put it in context, I was working at the World Health Organization in Geneva in March of 2003 when SARS, now we call it SARS-1, broke out. It was a pandemic. It was in 92 countries. We had 800 deaths, 8,000 cases, and we never seen it again. So we know how to do this. This time we just didn't. That's just what's so frightening.
I want to talk about, because I do a radio show and I've been using this individual as an example. A caller that called into my radio show, his name was Mike. That might be his name, might not be, but it doesn't matter because Mike called in and we had a spirited debate, as we have before, when it comes to the vaccine and the numbers of the vaccine. Mike's argument was that tens of thousands of people have died because they have taken the vaccine. I'm phrasing that wrong. Have died after taking the vaccine, that the vaccine didn't save them. He was throwing out numbers like that. Doc, I want to get your take on what Mike said. And I have more of what he said I'm going to question you about and give you an opportunity to respond to. But what do you think about the numbers he was throwing out?
I certainly haven't seen any numbers like that. The kind of numbers I've seen is 5 billion vaccinations given globally so far, practically no side effects. And I saw numbers in the U.S. that were maybe a handful who have died after taking the vaccine. And those were all people who had underlying medical conditions, so they were highly vulnerable. I think he's just making those numbers up, or he's quoting some conspiracy theorist. It's just not true.
Yeah. I'm going to go back to another thing he talked about, which is, I've made the argument that the people in the ICU that are on ventilators, that when you look at the percentage of that, it's the high 90s that haven't been vaccinated. That's the price. That's what's happening out there. He argued that just simply isn't true. How do you make an argument against Mike when he's not going to believe something as basic as the numbers? These hospital officials, these people that are asked to work with folks that haven't been vaccinated, they know whether or not they've been vaccinated. So how do you debate and take on a Mike that just within one Google finds the doctor or the person he wants to tell him what he wants?
Well, I'm a little ashamed to say it, Joel, but I've pretty much given up on dealing with people that they're just lying, or they're so afraid. There's a kind of science we call I wouldn't have seen it if I hadn't believed it. They're going into this with an idea in mind and trying to find some source, however disreputable, that they can quote and hang on to. And it's just not helpful. And it's very sad, people who will listen to them or follow them. Here's a context for you. Just in the United States last week, 1,000 people died from COVID, most of those in ICUs. 95% of those would be alive today if they had been vaccinated. That's what the numbers tell us. That's what the numbers tell us after 5 billion vaccinations. How much bigger of a data set do we need for quote-unquote proof? You don't have to be a scientist or a statistician to understand. 5 billion is a big number. And when you look at the effects from that big of a number, that's something you should be able to take confidence in.
Well, one more point on Mike, then we'll get
Sure.
to the plain and simple fact that FDA has approved Pfizer in the way that everybody was claiming it hasn't been yet, even though they gave emergency
Exactly.
clearance to use it. But I asked him how many times in his group of friends, in his church, in his coffee shop, in wherever he went to talk to people within his circle, how many times he made the argument that one of the reasons he wouldn't get vaccinated was because of the fact that the FDA had not approved this yet. They hadn't put their stamp of approval on it. Long pause, long pause, long pause. Then finally, well, yes, I made that argument. And I said, well, now, because that argument is no longer there, are you willing to accept the vaccine? Will you ever take the vaccine? He said, no, I'm never going to take that vaccine. And so for you to say that you've given up, I think is fair. I think is fair. And so, you know, I want to talk about the FDA because you mentioned how much better, you know, how much more research do you need than to have billions of people be vaccinated and you know that there's no side effects, that you can still have children, one of the big rumors out there, you know, all the different things that were spread as lies. What took the FDA so long? I mean, what put us in a position where we constantly were having to debate that?
Well, there's kind of two buckets of information here. One is science, and the other is regulatory bureaucracy. There hasn't been anything new in the science that somehow let FDA finally, you know, this week do the full approval. It's all been bureaucracy and process. I, as a former government official, was very disturbed by that. I mean, frankly, we're in a world war against a really vicious foe, this virus, and I think that we should count on our government to step up to the plate and respond accordingly. You know, like Pearl Harbor, what are we waiting for? So it's disturbing, but the science has been there. The science was there, or they wouldn't have done the provisional approval. They've just been going through process so that they wouldn't be accused, I guess, of short shrifting the process just because we're in a world war emergency, as if that's a good enough excuse. Well, now they've gone through that entire process. The same thing is true for, you know, why Moderna and Johnson & Johnson aren't approved fully yet. It's because those two companies haven't even done their full application for complete approval. I've done these applications before. They're unbelievable. They're costly. They're complicated. You know, they're volumes and volumes of paper and data. And it just takes time to produce all that, and then takes time for the FDA to review and analyze all of that. So when those companies finally get their applications in, I expect those to be approved very quickly just as well. But it's not because we were lacking in any scientific evidence. It goes back to those 5 billion cases, you know, the sample size of 5 billion to look at. We know these are safe, and we know they're effective. And we know that with 3 or 4 different platforms for the 3 or 4 different vaccines, all of them are pretty much equally effective, certainly effective at preventing death and serious illness.
So one of the arguments, Dr. Cohen, that I've made in terms of getting people vaccinated is going back to my life, which is the life of, if I wanted to go into school, I had to be vaccinated. I had to show my vaccine card. In 1966, when I was a kindergartner, you know, you went to Mrs. Stack's room and it's like, all right, have you had measles, mumps, polio, smallpox, all of those things, right? And so because of that, I was allowed to go into that classroom. I had a great Aunt Mary that lived her life in a shoe that was that much higher with a limp because she had had polio. Now, she lived a great life, raised a great family, and was a beautiful human being. But if you'd asked her whether or not that polio vaccine would have been made available, whether or not she would have took it, I have no doubt what she would have said. And so the point I'm trying to get at, and I hope we get a chance and you'll stick around and we can talk about, is
Sure.
the fact that it might come down to the Mikes of the world that you tell him he has to, or he'll lose certain opportunities because of that. And I want to get your take after this break on whether or not we should do that. In other words, forced mandates at work, at church, at ball games. Let's talk about it when we come back down the road. Dr. Cohen is good enough to hang with us and continue this conversation. Before the break, we were talking about the word mandate. You know, people can say mandate whatever way they want, government going door to door. That's not the point I'm trying to raise. What I'm trying to raise is Sanford, which is one of the biggest healthcare providers here, said you're not working for us unless you've been vaccinated. In my own personal life, I know of individuals that didn't want to. They went kicking, dragging, screaming to be vaccinated, but they knew they had to because of their passions, in life. This is what I want to do, and I can't do it unless I'm vaccinated. So in the end, I guess I'll take your vaccine. Should there be more of that in North Dakota? Now that we know that the president has put down Medicare, Medicaid, you have to be vaccinated. The workers that follow that. If the governor knows that Pfizer has been approved by FDA, should he require all state workers to be vaccinated?
Well, I certainly think so. But let's step back a minute. I don't know where these people are coming from. Public health mandates are not new. They're very common. Seat belts, motorcycle helmets. As you pointed out, vaccinations against childhood diseases just to go to school, to get in the first grade. I mean, anti-vaxxers, I don't get it. Look around. How much polio have you seen lately? Or measles, or diphtheria, or smallpox? It's pretty clear these things work. And they only work when everybody's vaccinated. Because when you've got an unvaccinated population, the virus has fresh meat, if you will. People that it can, in fact, infect and keep itself going. So it's just very selfish to not get this vaccine. And frankly, I don't understand it.
So what do you say to those individuals that would make the argument to you that, listen, you as someone who's vaccinated can carry and spread the vaccine no different than those individuals that have been vaccinated. And so if that be the case, the only people that I'm really putting at risk if I haven't been vaccinated is myself, because the other individuals are going to be put at risk anyway.
Well, that's really not true. That's another canard, if you will. It's certainly not a fact. We know that the vaccine, let me back up. A key point is that the vaccine wasn't designed to prevent anybody from getting infected. The vaccine was designed to prevent people from dying. And it's almost 100% effective at that. So underlying that whole argument or chain of thought, if you will, is that somehow continuing to spread a virus, which really doesn't happen, but even if it does, spreading the virus itself is bad even in a population of people who are vaccinated. No, it's not, because the people who are vaccinated are not going to die. And we know that from billions of cases so far. It's a rare case that happens, of course. In biology, there's no such thing as perfect. But we're not going for perfect here. How much more than 95 or 99% do you need to say, I want to be a part of that team? Join the global community. Why hold yourself out kind of on the virus's side and continue to give the virus an opportunity to spread, mutate, and make itself even more dangerous?
You use the word selfish. Let's expound on that a little bit. Selfish is a strong word. It is. But you said that those individuals that haven't been vaccinated are being selfish. Where were you going with that?
Well, I will say I can understand people being afraid of the virus. I can understand people being unsure of the government and unsure of the science, that they don't understand if they don't understand it. So, I can mitigate those strong comments a little bit by, okay, there are rational fears that people have. And so we need to talk with those people, deal with those fears. That's not the kind of doctor I am, but there are doctors who know how to modify behaviors like that. But I think information is, our very best weapon, and just address their fears. Now that the FDA has given full approval to at least one of the vaccines that's on this mRNA platform, the Pfizer vaccine, that takes away a huge argument, if you will, that people used to still be afraid of it. Frankly, I don't think it was a rational argument, but I understand that people had that argument and made that argument. Well, now they can't. Now we have a fully approved drug, just like aspirin or ibuprofen, things that people take all the time. Why? Because the FDA has run them through a rigorous safety and effectiveness study and concluded that in fact they're safe and effective. And in fact, there's billions of safe uses. This is just another such example. Just, indoor plumbing, probably the greatest public health advancement of all time. Do people use indoor plumbing? Well, that's a public health mandate. It's called codes in building and construction. There's just this whole idea of a mandate somehow being a freedom thing. I don't get it. I get the closest thing I can think of is motorcycle helmet laws in some states. Were repealed because people said, I have a right to go out and plaster myself on a pavement and become an organ donor. Well, yeah, there's all kinds of rights to do stupid things, but that doesn't mean the government has to sanction it and that the public has to pay for the consequences of your actions, which happens when people ride motorcycles without helmets and end up in very expensive health care that's paid for by all of us through our health insurance premiums. So this is just not new. This is everyday run-of-the-mill. Ask these people, did you get your tetanus shot? Because if you didn't, there's all kinds of things you're not allowed to do in life. It's the same thing. It's exactly the same thing. Only those bugs have been tamped down in the population because of the effectiveness over time of vaccines. Right now, COVID is winning. And right now, COVID, if I had to bet on who's going to win, it would be COVID, because that virus is mutating and getting worse faster than we can get a population to catch up to its prevention.
So we're having a debate in North Dakota in our schools and in other places about masks. And there are people that are just adamant that in schools there shouldn't be children that are forced to wear a mask. One of the individuals that called into my show today has a child that's, I think she was 8 or 10 years old, and she's mad at the school board in Bismarck, North Dakota, because they won't have a mask mandate. We've got other people who have been at school boards who have started screaming at the school board because they're going to require a mask mandate. Do you believe that if 80% of us were vaccinated, that we'd even be having a debate about a mask?
Well, I don't know, because it would depend on what the continuing incidence of new infections is, irrespective of the population that's vaccinated. What I have to say to these people fighting masks is, come on. I mean, how hard is it to wear a mask? I mean, these same kids wear masks on Halloween, and that's a fun thing to do. It's just a mask. It's basically a tissue. It's like blowing your nose into a tissue instead of out into the open air. I just don't see what the big problem is. I really don't.
One of the debates that I had with an individual about a mask was, and he had had a knee replacement, just like I have. And I said to him, I said, what would you feel like if the doctor walked into that room, didn't put on gloves, and didn't put on a mask? Once again, long pause. He said, well, that's different. I said, well, really not, because your argument is that masks don't work, that they don't stop anything from coming through or going out. I just don't know how to debate these folks unless you take away things they love to do. You can't go to the football game. You can't go to this. You can't do that unless you're vaccinated. It seems to me, Dr. Cohen, that that's going to be what it takes.
Well, that's exactly what's going to happen. And there will still be holdouts, of course, because, well, again, I'm not a behavioral kind of a doctor. I don't understand these people. But you made exactly the right point and analogy with the surgeon, and the knee replacement. And no, that's not different. Let's look at masks this way. The best arguments about masks are when you start getting into detailed particle physics and which kind of masks work how effectively and better than others and blah, blah, et cetera. But look at it this way. Let's say a mask is only 25% effective in reducing the spread of virons. Okay, if you're wearing a mask, that's 25% effective. If the next guy who's talking to you is 25%, then you've just reduced the amount of virus by half. So, and that's kind of a worst case. So, of course they work. The question is, do they work 100%? Like if you're in, exposure to radionuclides, and you're wearing a moon suit? No, but that's not what they're meant to do. They're meant to reduce the amount of virus that you're exposed to so that if you're susceptible, you won't inhale an infectious dose. And they work perfectly well for that, just like they work perfectly well in the operating room.
Dr. Cohen, you're doing everything you can to get people vaccinated. You're retired, and yet really you're still out there working. So I appreciate you coming on.
I thank you, because at the end of the day, with the government having done such a poor job of public health messaging in this crisis, and they have, and I feel very, guilty for my colleagues in the public health and scientific communities.
Yeah.
But
thank you, Dr. Cohen. I really appreciate you coming on.
Sure. I appreciate the opportunity.
We flat out ran out of time. I could listen to them all day. When we come back, some closing comments right here as we go down the road.